Hello, everyone, and welcome to another installation of the FAANS series on leadership in neurosurgery. And today we have the pleasure of speaking to one of our prototypical neurosurgical leaders, Dr. Robert Harbaugh. Welcome, Bob. How are you today?
I'm fine, Mark, and thank you for doing this. And thanks
Oh,
for this opportunity.
my pleasure. It's a great honor and always a privilege to get to speak to you. Yeah, I know you're very, very busy. So I'm going to start with just a brief introduction, Bob. It probably would take 3 hours for me to list all of your accomplishments, but I think a couple of key things bear introducing. You graduated from the Penn State College of Medicine, where you're practicing now, and completed your neurosurgery residency at Dartmouth, and then continued on as a member of the attending staff there and ultimately becoming the director of the Cerebrovascular Disease Center and Neurosurgical Laboratory and acting residency program chair. And then after a long career there at Dartmouth, decided in 2003 that you would return to your roots here at Penn State and accept the position as inaugural chair of the newly formed Penn State Department of Neurosurgery. You became the first graduate of Penn State College of Medicine to return as a department chair, which I'm sure was a great honor for you. Bob has since been promoted to the rank of University Distinguished Professor and named as a Penn State Alumni Fellow. And both of these are the highest honors for our medical school and Penn State alumni. Over your time as neurosurgical chair, it really has been amazing to be fortunate enough to witness your vision and leadership build a new department into a top performer nationally in clinical care and research, as well as a highly desirable residency destination, expanding from 1 to 3 residents a year and incorporating 6 CAST accredited fellowships. And then in 2018, to watch you begin sort of a whole new phase of your career in administration, assuming the role of senior vice president for our academic physician group, and then not being done yet as typical. In April of this year, you assumed the interim role as our chief medical officer for our main academic medical center, the Milton S. Hershey Medical Center here in Hershey. And now you're applying all of those amazing skills and leadership qualities that you use to develop a top flight neurosurgical program to helping us develop the Penn State health system. And by all accounts, really doing a tremendous job at that as well. And in addition to your busy clinical practice as a internationally recognized vascular neurosurgeon and your extensive administrative roles, you've been a prolific author and researcher and a highly sought after speaker. Dr. Harbaugh has edited several textbooks and published over 450 articles, book chapters, and abstracts, in addition to speaking at over 300 symposia and visiting professorships all over the world. And you've served on 5 editorial boards and obtained research funding continuously from NIH, among other national and regional organizations. But most of the folks viewing this video will know you as one of the top neurosurgical leaders. You have served in the top executive leadership position for nearly every national neurosurgery organization, including the SNS, ABNS, the Academy, the NeuroPoint Alliance, and of course, the AANS. And you've represented neurosurgeons' interests on a national level with organizations including the National Academy of Medicine, the AHRQ, the FDA, the Federal Traumatic Brain Injury Registry, and the NFL Head, Neck, and Spine Committee. And you continue to serve on the advisory council of the American Board of Neurologic Surgery, and you're the current chair for the ACGME Review Committee on Neurosurgery and the scientific board of the NINDS. And for all of these accomplishments and more, Dr. Harbaugh, you were the deserving recipient of the AANS Distinguished Service Award in 2018 and the Cushing Medal, our highest honor, in 2021. And despite all of these efforts, you remain engaged with the local community as a leader. You've served on the board of trustees of several of our local schools and colleges, as well as multiple entities within our Penn State health system. And I know you're a very dedicated family man with 5 children and married to Kimberly Harbaugh, one of our neurosurgeons here at Penn State Health, specializing in peripheral nerve surgery. So it really has been a privilege to witness your leadership and motivational drive as you continue to, just pile up amazing accomplishments after accomplishments for our department, health system, and our whole specialty. I really like to start by asking you, how did this whole passion begin? What was the spark that lit the fire that has become such a notable career for you?
Well, Mark, thank you for that very, very generous introduction. And just to say, none of it would have been possible without really outstanding people to work with, like yourself. I mean, this is a team sport, and I appreciate your kindness, but nobody accomplishes these things alone. And what led me to neurosurgery, when I was interviewing for my medical school interview at the Penn State College of Medicine, one of the people who interviewed me was Dick Berglund, who was the chief of neurosurgery here at the time. And he asked me who my medical heroes were. Well, I didn't really have any medical heroes, but when you're asked a question at an interview, you're expected to give an answer. And I had read a brief biography of Harvey Cushing. It was the one written by his secretary, not for any particular reason, but so needing an answer, I said, well, I've always admired Dr. Cushing. So he asked me a few questions to make sure I really knew something about Cushing. And then for the rest of my interview, I listened while he talked about what a wonderful person Harvey Cushing was. I found out later that he viewed himself as Cushing's grandchild, that he was trained by the last resident that Cushing trained. And so I got accepted here. I don't know if it was because of that interview or not, but shortly after I got here, Dr. Berglund asked if I'd like to work in his lab. And of course, you say yes. I was very thrilled to do that. So honestly, I never really seriously considered any other specialty than neurosurgery almost from the time I started medical school. At that time, there were only two neurosurgeons here, Dr. Berglund and Bob Page. There was no residency. A surgery resident would rotate on the neurosurgery service. So if you were a student who had interest in neurosurgery, you got to do a lot of things early on. And, they were a very charismatic group doing really interesting work in the lab. And so it was, only neurosurgery for me almost from the start. I asked them where they thought I should look for residency. They recommended three places. What is now Weill Cornell Medical Center. It was the New York Hospital then. It's where Dr. Berglund had trained. Yale, where Dr. Page had trained, and Dartmouth. So I interviewed at the New York Hospital and spent a month at both Yale and Dartmouth. And, those were great times. I mean, to see these busy neurosurgical practices with residency programs. At Yale, Joe Piepmeyer was a first-year resident when I was there as a student. Dennis Spencer was their new faculty member. Bill Collins, who was, the editor-in-chief of the Journal of Neurosurgery at the time, was the chair. It's a very prestigious program and a very good program. At Dartmouth, Ernie Sachs Jr. was the chair. Don Wilson was doing really interesting things with corpus callosotomy and using the microscope for spine surgery long before that was popularized. Dick Saunders was working on anterior approaches to the cervical spine. I did get offers. This is before the match. I got offers to do a residency at both Yale and Dartmouth. I think Yale was the more prestigious program, and my head told me to take Yale, but I'd really fallen in love with Dartmouth. As a country boy, I liked Hanover, New Hampshire a lot better than New Haven, Connecticut. And so I decided to go to Dartmouth, finished my training there, had a great time as a resident in all aspects of neurosurgery, including research, and then stayed on the faculty.
That's great. So, like many of us, you had the fortune to, work along some people who are very inspiring, and, you've more than returned that favor to the next generation by inspiring the rest of us. So that's a great story. Thank you very much. I'd like to next ask you, with such a long, storied career, what are some of the key contributions, the things maybe that you are the most proud of, or the things that you would like to really represent the top items on your legacy in neurosurgery?
Well, I think I divide those into two areas of service. One would be service to Penn State, and then one would be service to neurosurgery. For Penn State, this organization gave me two great opportunities. It accepted me into medical school. Nobody in my family had ever gone to college. And so to actually go to medical school was just almost unbelievable. And then they gave me the opportunity to come back as chair. And so, I'd really like to be remembered here as someone who repaid a debt of gratitude to Penn State, the College of Medicine, Hershey Medical Center. I am very proud of what all of us did here, developing the Penn State Department of Neurosurgery. I'd come here in 2002 as a consultant to look at the neurosurgery program, which was really in disarray, and wrote up my report, met with the dean, made my suggestions, one of which was to make neurosurgery a department. And so when the neurosurgery department chair ad was posted, I realized I already knew a lot about this program, had a lot of problems, but also a lot of potential. It was home for me. And so, starting in July of 2003, came back as the inaugural department chair. At that time, there were 4 clinical faculty members. We had 1 research faculty member without external funding, residency program on probation. We had a total of 4 residents. So, sometimes you feel like the only purpose of your life is to serve as a warning to others. I must say I had some difficult nights that first few months, having left a busy and stable practice to come here, and would this be a success? But I was lucky to have the support of very good people in the administration, and to be able to recruit really outstanding people to join the department, you included. When I left, when I stepped down as chair in 2021, we'd grown to more than 30 clinical and research faculty members. We ranked 12th in the Blue Ridge ranking for NIH funding for neurosurgery departments. Highly regarded residency program, taking 3 residents a year, our CAST accredited fellowships. So I think that I certainly left the department better than I found it. And, I'd like to be remembered as, returning the repaying that debt of gratitude I owed to this organization.
Yeah. I'd like to add for the group that didn't experience this, I came on just maybe about 2.5 years after you started. And for all the challenges that you faced at first, you seem to have the situation pretty well in hand within 2.5 years, and continue to make progress. It was amazing to see. So thank you.
So it was a lot of support, a lot of good people, and a fair dollop of luck too. So the service to neurosurgery, I've often, again, you just can hardly believe that you're a neurosurgeon. I mean, it's you think about the people who founded our specialty and what extraordinary professionals they were. And so I've never quite gotten over the thrill that I've been able to join that charmed circle, people who are neurosurgeons. While I was at Dartmouth, I did serve as president of the New England Neurosurgical Society and chair of the CV section. But I think the accomplishments I'm most proud of there is Nick Hopkins and I co-chaired the first endovascular neurosurgery task force at the request of then AANS president Roberto Harris. And at that time, there was a lot of debate whether or not neurosurgery should really get involved with this endovascular stuff. Was this just a fad? Was this something that radiologists did? But we concluded that neurosurgery really needed to make endovascular procedures part of our training, and that we had to get into this in a big way. And I think that had we not done that, we would be in a very poor position now in regard to the treatment of cerebrovascular disease. Mm-hmm. I'd also started my own, computerized registry, digital registry of all my carotid surgeries, and presented that at one of our national meetings. And I think based on that, was asked to chair the first outcomes committee. Initially, that was a joint effort of the AANS and the Congress, and subsequently just the AANS. And that evolved into the AANS Neuro Knowledge Program, which we did with Outcome Science, trying to make it the case that neurosurgeons routinely looked at their outcomes to judge the quality of their care and to improve that quality. That eventually evolved into the NeuroPoint Alliance, which is today a really vigorous outcomes assessment and quality improvement effort of the AANS. I also was initially appointed as a member of the Washington Committee from the Congress, and then subsequently by the AANS. While on the Washington Committee, started the Quality Improvement Work Group in response to the federal government's initiatives to improve what they thought was quality. And this was an organization under the auspices of the Washington Committee. And that's evolved into the Neurosurgery Quality Council, which is being revamped right now. I think is going to be a very important piece of our neurosurgical efforts going forward. I had the opportunity to serve as chair of the Washington Committee during the Obamacare debates, which was really a very educational experience. It also happened to be that Troy Tippett was the president of the AANS when I was chairing the Washington Committee, and Troy became my constant companion. Let's say Troy didn't like to leave things to chance. But it was a great learning experience working with all of the people on the Washington Committee, understanding how healthcare advocacy works, really getting an understanding of healthcare policy. And there couldn't have been a better time than the Obamacare debates because it had so much focus. So that was a great experience. Shortly after that, the concern arose that neurosurgeons were being shut out of neurocritical care. Perry Ball and I had worked to start the first neurocritical care unit at Dartmouth. Neurocritical care was always something that I was involved with for cerebrovascular disease patients. Our board said that neurosurgeons who were board certified were certified to care for their patients in a neurocritical care setting. And despite that, we're seeing more and more closed units, usually run by neurologists, where neurosurgeons couldn't write an order. So the Neurocritical Care Task Force for the FAANS and the Senior Society was formed. I chaired that task force, and we achieved leapfrog recognition for neurosurgeons as neurointensivists, which I think was really important in getting us back into the game. And then we also, at about the same time, I served on the Senior Society's CAST task force with Art Day and Steve Giannotta and Volker Sontag that really invigorated that organization. And we developed a CAST ABNS pathway for both accrediting programs and certifying individuals in neurocritical care. And I think today neurosurgery is an active force in neurocritical care, which I think is really important for our specialty going forward. And CAST, I think, has had a pretty profound effect on resident education. We all know that no neurosurgeon today practices all subspecialties. The general neurosurgeon is a thing of the past. And most people will focus on one or two areas and become really expert in that area. And with a 7-year residency, the thought was we should be able to train neurosurgeons to do all of the core neurosurgery work, and also have time to focus on one or two subspecialty areas. And CAST was the mechanism to allow us to do that. And I think we see more and more programs now who are making their chief resident year the 6th year and having an opportunity for residents to do an enfolded fellowship in a post-chief year so that they can leave their residency knowing how to do the core neurosurgery work, but also having the expertise in one specific subspecialty area. And then finally, I think we had occasional summit meetings, usually in association with either the FAANS or the Congress annual meeting, where we would just sort of talk over some hot topics. But one of the things that I'm proud of was starting the One Neurosurgery Summit summer meeting that brings together the leaders of all of our major neurosurgical organizations each year. And we use that to try to achieve strategic coordination across the specialty, for education, public policy, and really any specialty-wide initiatives. So I think I would like to be remembered for my service to neurosurgery, and I hope these things have left the specialty I care so much about better off than I found it. From a research aspect, when I was a resident, I started out working with one of our anesthesiologists and with Dr. Saunders on intraspinal narcotic infusions for pain. That led me to look at the intraventricular infusions of a cholinergic agonist for Alzheimer's disease. The theory at that time was that Alzheimer's disease was a cholinergic deficit, much as Parkinson's disease was a dopaminergic deficit. And it led to getting an R01 as a chief resident for a multi-center prospective randomized double-blind trial. And that was really the first such neurosurgical trial. And it led to a lifelong interest in clinical trial design and how collecting data prospectively, analyzing it, and using it for quality improvement was really vital. It's what we've come to call the science of practice approach, using the outcomes data for quality improvement. and more recently for real clinical research. I had started out as doing the pediatric neurosurgery at Dartmouth, not because I had any special pediatric training, but I was the young one and nobody else wanted to do it. Sorry, Mark. And I had 2 days a week, protected time for the lab as a physician scientist. And then our vascular neurosurgeon left to go into private practice, and Dr. Saunders, who was our chief at the time, asked if I would take on the cerebrovascular disease for the division. And of course, I said yes. And so I really switched my research focus to cerebrovascular disease. We had the first paper on the use of CT angiography to evaluate cerebrovascular disease. That was in the Journal of Neurosurgery in '92. At that time, that was really innovative. Today it's routine. CT angiography is just another tool, but I think that was a contribution. And it also started a long-standing collaboration with engineers. There is a bioengineer postdoc at Dartmouth, Madhavan Raghavan. He's presently the chair of bioengineering at the University of Iowa. And we've worked for a long time on methodology to quantify aneurysm shape and seeing if the irregularity of an aneurysm is a predictor of rupture. And when I got to Penn State, found another engineer, Vijay Varidan, that I've worked with since I got here to help develop, wireless monitoring capabilities. So I think from a research standpoint, those are the contributions I'd like to be remembered for. Clinically, I already said I started as a pediatric neurosurgeon, but switched to cerebrovascular and critical care. And, over my time at Dartmouth, I performed essentially all of the cerebrovascular cases and also the acoustic tumor cases with one of our ENT docs, Glenn Johnson, for about 15 years, and developed a database, prospective database of more than 2,000 carotid endarterectomies, most of which were done with regional anesthesia. And I would suggest that, you can look through all of the efforts to treat, carotid artery disease, and there's still nothing that's better than the series that we developed in regard to both perioperative and long-term results. And then finally, from an education standpoint, I had served as an acting program director at Dartmouth while our program director, Dr. Saunders at that time, had some family issues. When I first got here to Hershey, served as the program director and chair, and then turned the program director job over after the residency came off probation. I've had a great time serving as a director and eventually vice president of the ABNS, so looking at certification of neurosurgeons. And I'm in my 7th year now as a member and my 3rd year as chair of the ACGME's review committee for neurosurgery. And so through that time on the board and on the review committee, we've seen a lot of dramatic changes in neurosurgical education, the most dramatic of which I think is introducing enfolded fellowships. I know not everybody is enamored of those, but I think they are a huge step forward for helping us turn out the kind of neurosurgeons we need to in the 21st century, and for keeping neurosurgery together as a single entity and not having it splinter the way general surgery did. So I'll stop now, and thanks for giving me the opportunity to pontificate and pat myself on the back, I really appreciate it.
Well, Bob, it's easy to find reasons to pat yourself on the back with such a long list of accomplishments. And myself and all the other neurosurgeons that will be watching this, and in particular the neurosurgery trainees now and well into the future, really owe you a debt of gratitude for those things that you've accomplished for our specialty. I'd like to sort of shift gears a little bit, hearing about all of this incredible work that you've done. I know, from getting to know you pretty well, I'd say over the last 17 years that we've been working together, that, family life and family values and your life outside of work is something that's very important to you. And when you hear such a list of accomplishments, it's almost hard to imagine how someone could maintain that balance with the type of schedule that you've been maintaining here. But I wonder if you have any sort of pearls or tips of wisdom for the rest of us, for neurosurgery trainees, as to how going through your career you can maintain that work-life balance and your sanity as you go through this most demanding and most rewarding of specialties.
Yeah. Well, thanks, Mark. I mean, first, I'm going to have to say that I've always disliked the term work-life balance. Because it gives you the idea that work and life are antagonistic. It's like, well, my work's done now, I can start my life. And I think that has a bad effect on our trainees. Work is part of your life. And if you really love your work, it adds to your life. It's not something that you have to finish in order to get on with your life. So work and life are not antagonists. I've been lucky that Kim is a neurosurgeon too. She understands completely, all of the demands that specialty has on somebody's time. And I've had a great family. My church is a support to me. So I would see that my family, my church, my work are a seamless tapestry of my life, not antagonistic in any way. So I really never saw the need to balance one against the other. Work is a big part of your life, and it should be, I think, a big part of your life. And looked at that way, it's not all that hard to carry it out.
Thank you. So the title of the video series here is Leadership in Neurosurgery, and I think probably no one is more qualified in our specialty to speak on leadership than yourself. And I know you and I have had some conversations about this over the years after various meetings and things that we've been on together. But I'd be interested for you to sort of share with our audience some of your thoughts on leadership, some of your theories on leadership, and what you think are the important qualities for a leader to be effective.
Yeah, so it's something that you do think about a lot if you're in a position where people are depending on you. And so, if I had to try to distill that, I would say, first, don't ask people to do something you wouldn't do. They'll recognize that pretty quickly. Be unfailingly honest. If people come to trust you, they know that you may not always tell them what they want to hear, but they know that what you tell them is your honest assessment. They're going to help support you. As soon as somebody thinks that you're hiding something, lying to them, you lose a lot of trust and a lot of support. I think leaders have to be willing to give praise publicly to the people they work with. And also, it's important to accept blame, sometimes even if you're not at fault. It's not always, well, somebody else did it. I think a really good leader has to be bold, be willing to take chances. You're never going to get ahead if you just keep doing things the way they were always done. and it's bold but thoughtful. You're not firing from the hip, but you're trying to assess the risks and benefits and to move ahead where you think you need to push. And finally, I think it's really important that we be able to laugh at ourselves. We have to take our jobs seriously, but we don't have to take ourselves seriously. A meeting where nobody can laugh and have a good time is a really long meeting. And then finally, I think it's really important that we don't just treat people with respect. I hear that a lot. What we really need to do is respect them. There's a big difference, and people will pick up on it in a minute. I've met a lot of folks who know the right things to say. They're polite. They treat people with respect, but you can tell in a heartbeat that they don't really respect what you're saying. They don't really care to hear what's on your mind. And so that's very much different than really respecting people. Carl Boehner had a quote that actually I've often heard this attributed to Maya Angelou, but Boehner was about 20 years earlier, and that is, they may forget what you said, but they will never forget how you made them feel. And I think that means a lot. And this ties into another quote, do to others as you would have them do to you. And if you keep those two in mind, and you're honest with people, I think you have the basis for being a very good leader.
If I can add an observation here, having worked with you, I think one of your amazing skill sets is being able to identify what the talents of the people around you might be and what they might really be really good at, even before sometimes we realize that we may have those talents. And you just sort of generously and unselfishly sort of focus outward and help people develop areas of their career and sort of hand over responsibilities to them. And that's that type of authenticity and teamwork and outward focus as a leader, I think is very unique and part of what makes you so successful and something that we can all learn something from. So
yeah, I mean, I think that's a good point. If you have good people around you, and you give somebody an area of responsibility and say, look, this is something I'd like you to run with. I'd like you to develop it. I'm here to grease the skids. If I can help in any way, let me know. But then get off their back. Let them develop it. Check in now and then. But let them really own something. And I think that works much, much better than trying to micromanage every step of the process.
Absolutely. Well, one of the questions that I had wanted to ask you at the end here was, what were the pivotal moments in the development of neurosurgery over your career? And you've kind of already answered that in terms of all of the efforts that you've been involved with through the Obamacare and threats to the specialty, development of neurovascular and fellowships and the ICU training for neurosurgery. But I wanted to kind of end on, what do you think our biggest challenges are now as neurosurgeons, as a specialty, and going forward? What sort of concerns you about what we may face in the future? Where do you think our biggest challenges are going to be?
I think one of the big challenges is, how do we keep neurosurgery together as a specialty when we do so many different things within that specialty? And, we've heard suggestions in the past that, well, maybe, spine should become its own specialty. And so we would carve that out of neurosurgery, and maybe endovascular should become its own specialty, et cetera, et cetera. I think there's something really special about being a neurosurgeon, both from the history of that, from our founding principles of what it meant to be a neurosurgeon, the rigor of our training. I see this as we have a responsibility not only to ourselves, not only to our present colleagues and trainees. We have a responsibility to everybody who came before us, who started neurosurgery and brought it to this level, and all the people who are going to come after us. So how do we keep neurosurgery together? I think so far we've done a really good job. It's a vigorous specialty going into its second 100 years. But that is a threat that we have to be constantly aware of.
Mhm. Absolutely. Well, Bob, I think that were all the questions that we had for the interview here today. Are there any other closing thoughts that you would have, or before we thank you for everything that you've done and a really excellent interview and sharing your perspectives on a long and storied career with us here today?
Well, first, I just want to thank you, Mark, for not only this interview, but all you've done for neurosurgery, in Pennsylvania. For those who don't know, Mark served as the president of the Pennsylvania Neurosurgical Society. He's on the AANS board of directors, and has in our department has done an absolutely marvelous job of organizing our clinics and improving our access, doing an enormous number of things. At Penn State Health, he serves as associate chief medical officer. So you've been very kind to me, but honestly, I find it amazing sometimes to see how much you get done in the course of a week, and to do it with good cheer and aplomb. So thank you very much for all you've done for this organization, for our department, and for all of neurosurgery.
Too kind. It's only too easy when I have an example like yourself to try to follow and emulate. Thank you very much.
All right. Thank you. Have a good day.
You too.